So what we're trying to do today is bring together the stakeholders of the Cochrane Tobacco Addiction Group and to ask them what our priorities should be for the future and how we can better get our findings out there to the wider community.
This type of event and this type of process is really important to inform policy making and help to inform decisions at a local and national level. We need to know what our stakeholders think, what members of the public, what the researchers think, in order to be able to develop our policy in an evidence-based way and drive the agenda forward to be more effective in the policies that we develop and how we implement them to really make a difference.
My previous job was working in the vaping industry with NHS support alongside a GP, and it's something I really want to see continue.
Tobacco addiction research has come on hugely in the last 30 years, and the Cochrane Tobacco Addiction Group has played a massive role in moving that forward. So back before the 1970s, the studies that you saw were generally inadequately designed, inadequately powered and inadequately described. And then since the advent of the Cochrane Tobacco Addiction Group, then what we've seen is a huge increase in both the quality of the studies and also in our ability to synthesize the data from them.
We're doing this activity this year because 2016 is the 20th anniversary of the Cochrane Tobacco Addiction Group.
What I'd like to take away from today is just the satisfaction that I've helped, spread some knowledge and assist in the project.
This kind of activity is really important to our group because we really want to make sure that our findings are applicable to a wide range of people. There's really no point in doing this research if it doesn't get out there and get used by those people who need the information, such as healthcare workers, researchers, funders, policymakers. So in terms of what we're going to do with the results, firstly we're planning on writing them all up and getting them published in a scientific journal, but then we're going to go on and actually action the prioritisation points that people come up with, and we're looking to do that by the end of the year, carrying on into the future.